On to Chapter 30, Hematologic Disorders. So, red blood cell disorders. First one I'm going to talk about is polycythemia vera. So, too many red blood cells are produced. Polycythemia. High hemoglobin. And the treatment is to remove a unit of blood, phlebotomize them, take a unit of blood away. Too many red blood cells. Aplastic anemia is the failure of bone marrow. So they have low red blood cells, low white blood cells, a low platelet count. It can be caused by drugs or chemical exposure to toxic chemicals or radiation. Autoimmune hemolytic anemia. The bone marrow makes adequate amount of blood cells, but they're destroyed once they're released in the blood system. So that autoimmune, the body doing it to itself, anemia. Hemolytic anemia can occur after birth if the mother is Rh negative and the baby is Rh positive. The patients appear jaundiced and have high bilirubin from the blood being broken down. So red blood cells break down bilirubin, jaundice. They'll have a high positive Coombs test. The treatment focuses on the cause. What's the reason? What happened? Was it the baby situation? Was it something the patient was exposed to? So find out the reason and focus on the cause. Now, corticosteroids can be given because that can modify the immune response. Notice autoimmune. So modify immune response with corticosteroids if needed. Other disorders, iron deficiency anemia. The diet is too low in iron, or the body's not absorbing iron in the GI tract. So the body doesn't have enough iron to make hemoglobin. The patient has a low RBC, low hemoglobin, hematocrit. The serum iron level is low. They have a low ferritin level, a high total iron binding capacity, or TIBC. You might see some of those labs on some of your patients' blood tests. The treatment is iron supplements, such as ferrous sulfate, which is a pill, and iron dextran. And I can refer you back to table 29.5, where I talked about that in the last chapter. So ferrous sulfate can only be given orally. If it's a liquid, you have to dilute the drug and administer with a straw. I know I probably repeated that myself there from the last chapter, but must be important. Iron dextran has to be given as an IMZ track. Now, if the patient can just eat foods that are rich in iron, like liver, oysters, red meat, fish, dried legumes, which means beans or peas, dark green leafy vegetables, that would be great. You could try diet first. If that doesn't work, then might need the iron supplements. Pernicious anemia occurs when B12 is not absorbed from the stomach. So you're noticing I'm saying a few kinds of anemia that aren't necessarily a low hemoglobin. So pernicious anemia occurs when B12 isn't absorbed from the stomach. They lack that intrinsic factor to digest their food. It can occur in patients who've had a gastrectomy or gastric bypass. These patients suffer from fatigue and pallor. Well, that's common with any anemia, but the unique thing about this patient is they also present with a sore tongue. So as I was saying in the last chapter, when you check their mouth, check their tongue. Is it sore? Is it sensitive? Do they have numbness of the hands or feet? Now, the patient does need rest. The physician may prescribe monthly IM injections of B12 or cobalamin, or it may be given orally or intranasally. Another type of disorder, sickle cell anemia. Now, these are normally disc-shaped red blood cells that become sickle-shaped. So normally they're round. In this case, some of them are shaped like a sickle or part of a circle, a C, so to speak. This misshapen blood cells are fragile and they can rupture. They can cause anemia, or they may become stuck in small capillaries. So as they round the curve of a blood vessel, they might get stuck on the corner or the edge, and that might obstruct blood flow. Sickle cell anemia is inherited. It's seen exclusively in African Americans. But because it's a recessive gene, it has to be inherited from the mother and the father. So the mother and the father each need to have that recessive gene to be together and make a child with that inherited gene. Sickle cell crisis may be triggered by dehydration. That's a big one. Infection, again, that could lead to dehydration. Cold weather changes, excess alcohol consumption, and smoking, which is vasoconstriction, which can cause problem. Symptoms vary depending on whether the circulation is blocked by one of those sickle cells that have blocked an area, blood flow to an area, in the chest, the abdomen, joints, bone marrow, even brain. It's very painful, though, because you know when a blood vessel gets blocked, what does it cause? Like ischemia, which is a crying out for pain, for oxygen. So that's why at myocardial infarction, they can have a lot of pain. Ischemia causes pain, whether it's in the fingertips, whether it's in the abdomen, lack of blood flow, lack of oxygen, very, very painful. So remember, sickle cell anemia patients, if they get a crisis or a blockage, it's very painful. They'll need some pain medication. A lot of times they might get addicted to pain medication because they need it so often. So the medical diagnosis and treatment is treat aggressively with fluids. So remember, you know, if they get dehydrated, they need a lot of fluids because the blood gets thicker and the blood cells can get trapped. Instead of flowing easily, they get trapped. So treat with fluids aggressively to clear metabolic waste from ruptured red blood cells. So if they get ruptured, there's a waste, and the fluids help rid the body of that. Pain medication is necessary. Now, hydroxyurea is prescribed. That stimulates the production of a certain type of hemoglobin that's resistant to sickling. The thing is, it must be taken regularly. It doesn't work once a crisis occurs. So it's a medication that needs to be taken all the time. But it's been proven that patients that receive hydroxyurea have fewer crises. Patients experience fear. It's scary because it's painful. They don't know what's happening. Blood flow's being limited to an area. I once had a patient with sickle cell crisis. This one attacked her kidneys, and her kidneys suffered, started to fail. It's severe, frustrating. You need to provide consistent care and establish a trusting relationship with these patients. They're fearful. So we need to be very sensitive to the way they are feeling. Genetic counseling is recommended, especially if you know you're a carrier of this gene. Sickle Cell Disease Association of America can provide information and support. Now there's some coagulation disorders like thrombocytopenia. Penia always means too much, too little, too little. So this is too few platelets, too few thrombocytes, too few platelets circulating, thrombocytopenia. The major cause is related to inadequate production of platelets. That can be because of the treatment for cancer with chemotherapy or radiation therapy. Thrombocytopenia can be expected to last 10 to 14 days after treatment and lasts until the bone marrow is able to make more platelets, usually about a week. So again, let me repeat that. It occurs 10 to 14 days after treatment and can last 1 week. That makes sense? Lasts a week. Symptoms include petechiae, those little red dots under the skin, or purpura, which is bigger red dots, bigger red splotches. Not like a bruise though. It's a red splotch under the skin. Other symptoms could be gingival bleeding, their gums are bleeding, epistaxis, a nosebleed, or other unusual bleeding. It could be vaginal bleeding. We've talked about gum bleeding, nose bleeding. If they cut themselves, they bleed a lot. So it's a coagulation disorder. So another type of coagulation disorder is disseminated intravascular coagulation, or DIC. Now this is an interesting one because the blood clotting is abnormally decreased. So it occurs when overstimulation of the normal coagulation cascade due to other pathological processes such as sepsis, shock, major trauma. So a major car accident or a trauma, crush injuries, burns, cancer, or OB emergencies like abruptio placenta or fetal demise. So here's what happens. Coagulation occurs at so many sites that the body eventually depletes itself of platelets and clotting factors. So even though, let's look at the name, it says disseminated intravascular coagulation. So yeah, you had coagulation, you had the normal cascade, but something happened. You had major trauma and your coagulation factors are all used up. So then they get uncontrolled hemorrhage. The blood tests to diagnose DIC are ProTime, PTT, FDP, D-dimer. Usually 3 out of these are diagnostic for DIC. I'll tell you, when a patient goes into DIC, it's very difficult because really pouring blood into them isn't really going to help. So they've talked about heparin therapy, but that doesn't really help because you're really fighting not only coagulation, but then you lose them, your factors. So it's a catch-22 situation, and it's a bad situation when a patient gets to that level. So some other coagulation disorders, hemophilia. Hemophilia is a genetic disease where blood clotting factors that are normally found in the plasma are lacking. So they're lacking certain blood clotting factors. Now there's a hemophilia A where the factor 8 is missing. And that's sometimes called the Christmas disease. In your book, it talks about how it was named the Christmas disease because someone by the name of Christmas was first discovered with this patient. Also, there's hemophilia B, where factor 9 is missing. Now, the trait is carried on the X chromosome, so women carry the trait. But women don't normally have hemophilia, the men do. So it's passed on to their sons. There's incidence of no family history, but it is rare for a woman to have this disease. Uncontrollable bleeding is the hallmark of hemophilia. There's no cure. Treatment may be just multiple transfusions. They may need pain relief. And of course, they're going to need prevention of accidents.